the definition is the problem in here of our first question: what defines, or how do you define identity? It's like, I don't know. It's kind of the everything. I am the everything, and I am, also none of them. It's kind of weird, and that's probably where we go down the rabbit hole with the philosophical stuff. It's like, well, are you this, or are you not that?
Okay, life can be crazy. You're feeling like you're sinking, just trying to find a meaning. It's time for better thinking, yeah, better thinking. Time to tune in. Let's go.
Today's episode is another one with Mary Andreadis. We're talking about identity, what it is, how it's formed, some complex issues with the philosophical nature of where does it start, where does it finish, and we look at some harder spaces around like multiple personality disorder and gender identity. Some of these things are really complex and hard, and the idea of this particular episode is to stimulate some thought, some conversation about what is it, so that when we reflect on ourselves or we want to go out and push our lives in a particular direction, that we have a little bit more agency about doing so. Enjoy this episode, and once again, please go out and share, subscribe, let others know. It makes a big difference with our numbers growing, and they have been month after month, so we're very, very excited, and thanks to everyone who's listening. Hope you enjoy this one again. Hi Mary, great to have you back on the show, and I believe today's topic is going to be about identity, and we've at least prepared some type of basis as to some of the spaces of what we're going to talk about. And I know that there's some tricky spaces to go to in this one in terms of what's identity and the like, and particularly when we start to pull that apart, because there's so many different aspects of who we are. So great to be able to chew the fat with you, so to speak. Welcome again.
Thank you so much, Nesh. It's great to be back on the podcast. And as you said, today we'll be having a bit of a chat about identity. And identity is something that is so fundamental to each and every one of us, and the way we live our lives and the way we behave. And it's, in a sense, a bit of a psychological and a philosophical kind of topic that's quite complex, and I kind of realized how complex it was as I was doing a little bit of reading for this podcast. So to start, I thought maybe we could just have a bit of a general chat about what identity actually is, because it's actually quite tricky to define, as I've recently learned.
Yeah, I suppose the answer there is I don't know. I don't know what it is. In so many ways, I kind of have a little bit of a basis and understanding, and at the same time, it's very kind of blurry around the edges. Obviously identity encapsulates things like how we see ourselves, how others see us, goes into things about how we, are perceived from our trait level, from our behavioural level, identity about what our interests are, how we kind of show up in life, and this is where it starts to get blurry about what's identity and in some sense, what's personality, and is identity and personality the same thing? I'm not quite sure. From an identity perspective as well, it's also about our roles, so it's not just traits, it's our roles. Part of my identity is a psychologist, but I'm also a father, sort of son. There's so many aspects to it. So I'm not really sure what identity is, but it would be interesting if we were to ask a whole, group of my friends, who is Nesh, whether there's consistency there, and does that say something about maybe who I am, or how I project myself, and is there appreciation of who I am actually accurate, or is it how I display myself as to who I am, and is there a different Nesh that other people see than what's actually there? So it's complex. There's definitely that philosophical sort of question mark around what is it, and how do you define it? How do you go out and measure it? And that's hard.
And as you said, identity generally does encapsulate so many different aspects about traits, personalities, behaviors, and they can change really drastically from when we're a little kid, a newborn baby, until we go through our childhood and adolescence and adulthood. yet we still always have this sense of, I'm still me, and I'm still that same person that mum and dad brought back from the hospital when I was a little newborn, even though we can't necessarily remember too much about that, and we've changed immensely since then. We still have that same sense of, I am who I am. And I'm wondering if you had any thoughts about where that comes from, why we still feel that we are that same person, even though we've changed so drastically.
Yeah, it's a really weird sort of experience. I recently just had a celebration for a major milestone birthday, and that's brought me to kind of think a lot. And although I'm turning 40 in the end of this month, I had my early birthday, but I don't feel 40. I don't feel that even my identity is 40. In some sense, identify as being younger, and I know that a lot of people feel that. Sure, my body probably doesn't do what I would want it to do when I was 20, but so much of me still feels like I have, a lot of youth. And it's kind of interesting about, what my feelings are. Versus, how that might be displayed. And it would be kind of weird, or strange or odd or different if I were to start to dress as though I was 20 or even act as though I was 20. And so it would be quite interesting to I've certainly seen clients who have dressed, if we can call it, outside of their age group. And, there's a marked sort of experience. You can see that so quickly and easily. It's just fascinating to see that move. So there is this sense of I am who I am. And we kind of know that because, if I cut my hair, not that there's anything left of it, or when I did cut my hair once upon a time, I was still me. But at some level, I'm like, but I'm a different me. I've gone from, long hair to short hair, or I've gone from this style to that style. We know that people after breakups, it's not an uncommon thing, particularly for younger persons as well, to go out and do this big drastic change of, haircut. It's almost like I'm going to change who I am, or I'm starting afresh. I'm building a new identity, getting back into the gym or whatever it might be. And it's kind of confusing to try and figure out, what that is, but there's certainly something that remains, there's something that's solid. And maybe that can be explained a little bit by the, 5 personality traits. And interestingly, I'm probably diverting a little bit here, but if we look at personality and identity, if we look at the DSM, not that I'm a huge fan of that at all, but we went from a category called multiple personality disorder to dissociative identity disorder. And it's interesting, it's gone from personality to identity, and we've interchanged those words, at a psychiatric level, and that's supposed to be, in some sense, the Bible, so to speak. Yet those words are now interchangeable. If we think about it, it's moved from one category to the other. Now, some might argue, they're different things, but I think it's quite commonly known in the industry that we're trying to explain the same thing. The criteria have got, to display that as well. So it's kind of interesting to try and see what is this? Is it, if it's a personality thing, we know that personality traits are fairly robust over time. They do change over time a little bit, but they're fairly robust, whether that's, openness, conscientiousness, agreeableness, extroversion, neuroticism. Did I say conscientiousness? Agreeableness.
Yeah.
So they're fairly stable, and we know that as people age, there is a change in that, and we all know that our personality does change over time. For example, as you get older, you tend to be a bit more agreeable, you tend to be a bit more open-minded, and you tend to be less neurotic. And so we know that there's changes, but there's fair stability over a lifetime. So it's kind of like there's things that are stable, there's things that move. It's still blurry. The consensus is not always there between all schools of thought. But I think we've nailed it down reasonably to those things around. The personality traits are fairly robust. And then in some sense, we can kind of understand how someone is, what their interests are, whether they're patient or not so patient, whether they're, kind and compassionate and nurturing, or whether they're harsh and judgmental and so on, and whether people stay that way. We can all be something, temporarily or from time to time. I suppose we're kind of asking what expresses itself most often. How I feel is probably very different to what I show on the outside, though. So the identity is like, we know in particular people, identity can be kind of fractured or unstable, and we see that in spaces like that multiple sort of personalities, or for example gender identity. We can see these days in particular lots of young people are in some sense identifying with one type of gender and then another gender and then changing that, and we're finding there are lots of different categories of gender that are showing up, and I'm not even sure what to make of that either. It's so complex and hard to understand. If I can just change my identity, does that mean I can change any category of how I feel? As a psychologist, it seems reasonable that I can just have any category of how I feel. I can feel anything. The validity, though, has to be kind of asked, a little bit, or actually questioned or thought about. Because as we go to those real extremes, it's going to be harder to go out and kind of look at it in that same way. So I think feelings are very reasonable. I can go and say, I feel 20, but I'm not 20. I can dress like I'm 20, but I'm not 20. So, and that's just reality. So I don't know if our feeling is our identity either, because if someone says, is Nesh 20? We go, no, he's not. He dresses like he's 20, but he's not 20. It's like, well, I can go out and take that as an insult and say, well, that's insulting. I am 20. Why would you treat me as though I'm 40? I mean, it's a hard sort of space. It's a real hard space, and particularly with, controversial things like, gender.
It's a really tricky space. And as you said, we can change lots of things about ourselves, yet there's still something fundamental that tells us, I am still me. So for example, even with the concept of gender, we might change the way that we look, we might even undertake, surgical procedures, and we might identify differently, but we still have that feeling that I am the same person, I'm still me in some fundamental way. And it's really interesting to kind of consider where that comes from. And I guess we can look at it in a couple of different ways, and perhaps one of them is that we're still in the same body. So, from when we're a newborn, even though we've grown and changed, we're still sort of in the same body. But then again, we still would feel the same. We would still feel that we are who we are, even if, say, our leg got chopped off, or we changed our hair, as you said before. So, you kind of wonder as well, is that really what's giving us that sense of identity? Is it our memories, the fact that we can remember, the fact that we went on a holiday back in 2008 to Europe? But then again, is that really what defines us? Because as we know, as we age, our memory declines. Many people develop dementia, Alzheimer's, yet we still think that they are who they are. So it's really interesting to consider where does this sense of self and the sense of oneness really come from, even though there's so many different aspects of ourselves that are changing over time.
It's bizarre. And the opposite question is, where does, instability in identity, or if I look even beyond that, a third category of saying, where does incongruency with what I've been, born with and, what I feel, where does that come from? I tend to say, looking probably from an ACT perspective, is we feel what we feel, and we have thoughts, and we don't necessarily choose our thoughts, but we can certainly observe them, notice them, and then decide what we choose to do with those, or how we choose to relate to those, and likewise we can choose to relate with our feelings as well, and I can deny my age, or I can say I don't feel congruent with my age, or I can relate to it and say, yeah, look, I might not feel congruent, but I don't really care. It's not an issue. Yet there are lots of people out there who will go out and actively fight against an age. They'll say, what's your age? What's your birthday? And they say, I'm not going to tell you. It's almost like they've taken on a persona or an identity around this age and what that means, and they're saying, I'm going to reject that. I don't want that. And so in some sense, there's kind of like a denial or a rejection of something, but that's on the basis of a judgment, judging that being 40 is wrong and that being 30 is better, or having wrinkles on my face is wrong versus wrinkles on my face is wrinkles on my face, having, whatever feature. And so when there's incongruency, I think it would be awfully painful and difficult to go out and say, I don't want to relate with what's here. Or there's two features about my life that I don't, relate with, and I don't want to look this way, yet others see me this way. I don't want to feel this way, yet that's how I do feel. It's very complex, and philosophically, it's because we ourselves have a lot to say about who we are, what our identity is, and in some sense, we tell other people. We can actually even announce it, this is who I am. And that's complex because people tend to just follow whatever people say, about themselves. So, and why wouldn't you? It makes sense to do so. It just kind of gets very, very tricky when we might meet someone who, not that I've ever met anyone with multiple personalities, and I've asked many of my colleagues, and I'm yet to meet anyone who has met anyone other than on TV show or something like that, where someone has multiple personalities. But if someone says it, then we just say, well, okay, well, fair enough. I'm not going to question that. But it just seems like it's really, really odd. It almost looks like someone is putting on a play, and I'm certainly not suggesting that that's what's occurring. I wouldn't know. But it looks like it. It's almost like if I started to speak in a high-pitched voice and say, well, my name is Jennifer and this is my other personality, I'm not sure. Is there a secondary gain that's coming from that? Is this a genuine psychological or psychiatric condition? I don't know. I've never met anyone in that space, but it asks this huge question about, can we even have multiple personalities? Now, some people argue yes. I've heard even people saying, not that I can corroborate this and say that it's valid and accurate, I've heard that there are sometimes biological markers that can change with different personalities in, dissociative identity disorder, where someone might have, for example, I'm going to make this up, but something like, let's say, high blood pressure in one personality and not in another. Now, I don't know whether that's actual research or whether this is he say, she say. I've heard that story, but is it valid? I'd love to hear from another psychologist that's read, a peer-reviewed, a journal that's come from a great journal that's looked at a decent sample size that goes out and says we can, there's solid evidence to this. I'd have to suggest there is. How else would the DSM have been written? But at the same time, we've also said that homosexuality was an illness as well, and we've since removed that. So there's a lot of question marks. It's a difficult thing to put your finger on.
Yeah, dissociative identity disorders are a really, really interesting one. And as you said, it used to be called multiple personality disorder, and now we've kind of switched that to dissociative identity disorder. And I suppose there's a few disorders that come under that sort of umbrella of dissociation in general. And I think it's called dissociative amnesia or depersonalization disorder, a few of them where we kind of lose that sense of self. But I suppose dissociative identity disorder is a bit different in that we're actually almost taking on another personality. And I wonder where that comes from. And from the research I've done, I think a lot of it can come from trauma or some sort of significant event in our life that's occurred. And it's almost can be, in some instances, like a coping mechanism that we've developed perhaps from a young age. So if we're very young and we're experiencing some sort of abuse or neglect, physical abuse from a caregiver, we may kind of create this other persona, this other identity that this abuse is occurring to. And that's really, really functional when we're children, because we don't have the resources, we don't have the coping mechanisms to deal with that trauma that is being inflicted upon us. But I suppose as we grow older, if this identity kind of sticks around, it can become non-functional and pathological, really, as we grow older. So it's a really tricky one, and like you, I've never met anybody with dissociative identity disorder. So it'd be a very interesting space to kind of delve into.
And it's really kind of funny in the sense that I've certainly read that as well, in terms of it's very trauma-based. I think the number floating around that I recall is 90% of people who, have met that diagnosis, have experienced childhood trauma. It's kind of an odd one if we're not seeing this, as clinicians, the question of does it exist? Because if there's a whole gamut of human experience, and we're kind of saying, one in a million people, or whatever the number is, I don't know what the statistics would be, does that require a category? I bet you and I would be able to find someone who identifies as a penguin in the world. And, do we say that's an identity thing, or do we come up with a new thing that, someone feels like they're an animal, but they're not an animal, but we've got to go out and kind of hold this gently and kind of respect someone's, feelings. Do we call it insane, or do we go out and say, no, everyone's allowed to feel however they feel, and that's kind of reasonable? And, how about people who go out and change their faces? They feel like they're a cat or something, and so they, create whiskers and, tattoo up their faces and put in, things in their eyes and, eyebrows. And so we've seen these kind of, very fascinating and interesting ways that human beings can be. I just don't know if we place categories, or do we just go out and recognize that, hey, identity has all breadth. From a eccentric, 86-year-old, man or woman who's got a bunch of energy and they've coloured their hair purple, and, they're doing plays and they're outspoken and all sorts of stuff. And we go, whoa, now there's a, bundle of, energy right there. And, we might kind of embrace that because of their age. Or we might go out and say, wow, that, 22-year-old who's coloured their hair, they're just attention seeking, and, we make a negative judgment of it. It's kind of fascinating how society holds these things as well. So I don't know about, the dissociative identity sort of space, how much research there is, but the category has to be awfully small, at least in my clinical experience, because I've never seen it. And maybe that says about where I've worked. Maybe that is more of the reason. But I've certainly spoken with plenty of my colleagues, and not once have I ever heard one of my colleagues say, yep, a client comes in and, they've got 3 personalities and I never know who I'm going to get, and they change in the middle, and that's how they actually walk around in life. I've just never seen it. So it's hard to then talk about it.
It's a tricky space. And as we spoke about before, that whole umbrella of dissociation is quite broad, and dissociative identity disorder is, I suppose, lack of a better word, sort of the more extreme kind of version of dissociation. But it's interesting that we all kind of do dissociate, whether we realize it or not, in some way. So when we're kind of idly daydreaming, that's a form of dissociation. When we're absorbed, or we're kind of in flow, as we refer to it, that's also kind of a form of dissociation, in that we're kind of losing that sense of time and space and self-identity. So it's an interesting space. Yet throughout that whole kind of experience, we kind of come back and kind of still remain with that sense of self, I guess, identity, even though we've lost it temporarily, so to speak. So it's quite an interesting area to look into.
And it's also ties in with what we've discussed previously around, for example, loneliness, that if we have an identity which says I am different, or I'm on the outer, this strongly held belief, or, chronic isolation, or chronic, loneliness, that can be your identity as well. And, on the basis of maybe being anxious or something, and being afraid of reaching out, or kind of, introducing yourself, or doing small talk, or because of, lack of social skills, you start to even build that, and there's an evidence base for it, because someone says, well, how do you know that's who you are? You're like, well, let's use my history as my evidence. And I can't argue with that. It's really hard to go out and argue with that. Not that we can't work on trying to change that, but it's quite fascinating that, how we, witness ourselves, observe ourselves, notice ourselves, how we see ourselves, and certainly perceive and judge ourselves, kind of in some sense becomes who we are. And that's interesting as well. It's almost, if we look at philosophically, and in some sense what's attracted me to psychology so much, is it's almost like I can decide on who I'm going to be. And I know that contradicts with the 5 personality traits, and saying, they're fairly stable. And then there's another part in my mind which says, yeah, but I could if I wanted to, and people will say, well, you're playing a role, you're playing a particular persona. And it's like, well, I'll do anyway. I play a persona when I'm a psychologist. I play a persona on this podcast. I play a persona when I get home. I play a persona when I'm with my parents. I play a persona when I'm out with friends. I've got different hats, and so I'm different in those worlds, and that's kind of hard. And I recall actually, growing up, when sometimes I brought my 2 worlds together, and in one persona I may have been more serious, and in another persona I may have been more of a clown. You try and bring those 2 together, and you're scared that you'll get rejected from both those groups, because you're saying, oh my goodness, if the serious group find out that I'm a clown, they're not going to like me, and if the clown group realize that I'm serious, they're going to think I'm a nerd or something, and they don't like, what do I do? And there's a conflict of who am I? And in some sense, that's an incongruency of saying that I can't be both. And maybe as we mature, we go and say, well, maybe I can be both. Maybe I can be both those things, and that I'm actually neither of them at the same time, neither one nor the other, defines me. The definition is the problem in here of our first question, what defines, or how do you define identity? It's like, I don't know. It's kind of the everything. I am the everything, and I am, also none of them. It's kind of weird, and that's probably where we go down the rabbit hole with the philosophical stuff. It's like, well, are you this, or are you not that?
And is there a sense of a true self that's buried underneath all of these personas, or are they just all different aspects of ourselves, really? And I think getting bogged down in that question can lead a lot of people into what we kind of refer to as an identity crisis, where we're sort of having the sense of, oh, I thought I was this one person my whole life, but now I'm in this different situation, or this event has happened to me, and now I'm just not sure, because I'm seeing myself in this different light. I'm seeing different traits that I possess. I'm behaving in different ways, and now I just don't know who I am anymore. And I think that can be really anxiety provoking for a lot of people who have had that sort of sense of a stable sense of self, and that's kind of disappeared. So I'm wondering if you could speak a little bit on that concept of an identity crisis and what that might mean for different people.
Yeah, look, it's an interesting one, because I think an identity crisis can happen at any stage of life. I mean, we see young people these days having lots of, maybe if we drop even the word crisis and kind of say, that someone is conflicted or confused or unsure or, not wanting a particular identity. We're almost trying to forge something, but we don't know what that is. We're looking for congruency, but in a certain way. So there's this kind of conflict with identity, I believe, where we identify with something that we don't want to be true, or we don't want it to be attached to us. So kind of like the space of, I might be a clown and I might be a nerd, but I'm hiding each of those from the other group. There's an identity sort of conflict or tension, and that comes from judgment. It says it's not okay to be a clown in this context, and it's not okay to be serious in another context. And so by virtue of judgment, we go out and start creating these personality or identity crises, the way that we view ourselves. And so you can see, a lot of people, of recent in particular, and in the past as well, because it's not a new phenomena, but certainly a much more pronounced phenomena of late around gender identity, and people being unsure as to, where they fit. And part of the problem is we try and categorize things. So rather than saying, I'm not going to judge, gender for a particular reason, we're kind of saying this is right, this is wrong, this is good, this is bad. And the moment we start doing that, we start saying, well, this exists, this doesn't exist. And the moment we start saying this doesn't exist, well, then there's going to be some pushback saying, well, yes, it does, right? And then we're going to involve a whole bunch of scientists to try and disprove each other. And if anyone's gone to high school, they know how to write an essay, and you can write an essay on any argument that you want. And so this is why the idea of let's try and go back to scientific method, which has lots of broken bits as well. But all these efforts are on this effort to try and understand, but as part of trying to understand is we categorize, we label. And so the moment we label that I'm 40, that comes with a whole lot of other meaning, right? This is the relational frame theory that Steve Hayes talks about and has written about, and is awfully difficult and confusing to understand. And as much as I try and put my head into it, I still don't get it. But some of the premise of it is there's a relational frames, or there's meaning attached to each of the words. And every time that we place a word, language is bound with meaning, but there can be multiple meanings, or certainly lots of judgmental meaning. And part of the issue is how we connect all those meanings together. So, to go out and say, once upon a time, I am gay, was looked upon as, my goodness, there's something wrong with you, that's awful, so on and so forth. And these days, we've got a very different meaning, which is, yeah, we're a bit more accepting, and I know someone who's gay, and so that's now okay, but we're still not there, right? Maybe in 50 years' time or 100 years' time, whatever years' time, it'll be maybe not even something that needs to be said. That we don't have a category of saying, I'm, heterosexual, I'm homosexual. Maybe all these categories that are coming up at the moment, the LGBTQI plus, and I don't know if that has changed, and it seems to keep moving, and that's not a criticism, it's just an observation. Maybe those things will morph into something else. Maybe we'll give it a different, encapsulating umbrella, right? But it might continue to go further. We might get rid of it one day. We might actually remove this idea of, mums and dads, and move to parents. And, we look at this language. I know that the forms we use in our clinic, I've been so considered and thoughtful around what's the language that you write when there's, consent. And so, rather than writing parent, because it might not always be a parent. So, it's parent/caregiver or, primary caregiver. And you just keep changing it. You can never get it right. And I feel that with the identity, I don't think we can get it right. Even if I say I'm a psychologist, it's like, okay, that's part of your identity. By virtue of language and the way that the mind thinks, it'll say, well, are you a good psychologist? Or are you kind of an average psychologist? Are you secretly a mediocre, a psychologist that's, doing this imposter thing and you're only going to get found out sooner or later? Like what's going on here? And it might not even sort of extend to that. It could be, any type of experience. I mean, there are people feeling that they have, for example, an urge to have multiple partners. And they feel that's part of their identity, but functionally it's not going to help with what they're trying to sustain in terms of, a family together. And they're fearful of, if I go out and talk about this, my partner's going to leave me. And so maybe they go off and they do that in secret, or maybe they just sit with that and sit with the feeling and maybe not judge it and just say, well, it is what it is, but I'm not going to follow it. It's really hard to know what, how these things inform what we go out and do. But it seems to me that identity is fluid, and anytime we try and examine it or we try and measure it, we reflect on it, particularly with milestones or transitions, we move back into that space of an identity crisis, as you call it. We become unstable, unsure, we question, we become existential. It's a very complicated thing to look at, because often maybe also there are traits in me that if I look at them, I'm not quite happy with, and I might say, no, that's not me. Everyone else might say, well, yeah, it is. You're a stubborn ass or something or other. And I might go, well, no, I'm not. I'm just passionate or something, It's interesting to, see how that works. And, if I am extremely stubborn and I believe I'm the smartest and I'm the best and my opinion should be listened to and everyone else's should be, put aside and I'm superior, I might not necessarily see that I might have narcissistic type of, traits or be quite unpleasant and arrogant to be around. And I wouldn't see that. And so I wouldn't even identify with that. And that's what's quite interesting. So people's experience of me could be very vastly different than what my own experience is. And so, what's identity? I don't know.
So I guess it's kind of almost two sides to it. It's the way we perceive ourselves and then also the way that we're perceived by others that all kind of seem to contribute to this sense of identity. And just in my own experience working with people who have a particular diagnosis, whether that be depression, anxiety, PTSD, obsessive compulsive disorder, whatever it is, there's almost a sense of, this is who I am. I am a person who has depression. I am a depressed person. I am an anxious person. And in my own experience, I've had people that I've worked with that are almost scared to move away from that diagnosis, because then who are they? They've lived their whole life being this person that has depression, who's, depressed, who's, going through problems. And there's almost this fear of coming out of that because of, I guess, the fear that it might lead to this sort of, identity crisis, or this wondering of, who am I now? But I suppose looking at identity as fluid and not fixed and not categorizing it might be sort of almost like a way around that, and kind of give people that sense of optimism around, hey, you don't have to be this one thing forever. We change so vastly throughout our entire lives, and even when we touched a bit on personality, and the big five, as you said, are quite fixed. But they can change to an extent as well. And the example that came to mind was, for example, someone who might have a acquired brain injury, or a brain tumor of some sort that could drastically change their personality. Someone who was very calm and placid might all of a sudden become very aggressive, and saying some nasty things. So it calls into question, who are they anymore? They're not this nice person that I once knew. They've changed. It's an interesting space to get into. I'd love to hear your thoughts on that.
And it sort of rolling on from what you say, when we think about it, even depression itself changes the way that we go out and identify. So, yes, there are people who identify as being depressed, but being depressed makes you also kind of look through that lens and see the world in a particular way. So, chicken or egg type of scenario, the context also tells us about how we should identify. It's kind of interesting that if we look at this space of, acquired brain injury or something like that, we might go out and see that, as you say, someone's personality changes. And, often as well for, more favourable, whatever favourable means, but sometimes for more, in more favourable directions, like someone might become more extroverted. But we do tend to find in those sort of scenarios where disinhibition starts to occur. And in some sense, we could kind of argue the same thing around some of the mental health sort of aspects, where if someone is highly anxious, they might kind of get particularly cranky about removing themselves from a particular scenario that they don't feel like they can get out of, and so they might be rude or abrupt or irritable or whatever it might be. And so we'd say, well, that's maybe their personality, or maybe it's not their personality, maybe it's their mental well-being, and maybe their well-being is kind of been impacted by how the world is, and how the world is kind of expresses itself in that mental health. So it's kind of interesting. I don't know where this identity sort of stuff, starts and ends, because I'm just thinking off the top of my head while we're talking, I imagine who would I be if I was born in the 1630s?
Mm.
Would I be me, or is the context forming my identity as well? And in some sense it has to, right? I mean, I see myself as being an Australian with, Serbian heritage. That's because that happened to me. I just happened to have parents who were born in Serbia, whose parents were born in Serbia, whose parents were born in Serbia. And then we flew over to Australia, but I learnt English, somewhat as a second language, but in actual fact now it's my first. But it's like, who am I and who's my identity? At the start, my identity was I'm Serbian. That's all I know. Serbian language, Serbian food, Serbian parents, Serbian friends, you're in the Serbian community going to a Serbian church. But you're living in Australia. And so now it's like, well, so who am I? And there's a lot of conflict in that. You end up saying, well, I know what I am. I'm different. So now my identity is I'm different. I don't belong, or whatever it might be. Or you go, I'll tell you what I am. I'm a good soccer player, and that might be reinforced by, mum and dad, or the community, or, by achievements. So then you move into that space. And so I forgot what your question was. I've sort of rambled a little bit, but
I forgot what it was too.
But when I kind of look at the formation and where does it kind of come from, the complexity and the context says so much, and hence where the moment there is change, we change our identity as well. There's no doubt. At the moment, there are tens of thousands, well, there are millions of students, for example, going through the phase of being a student, right? That's just a life phase. And we all tend to, well, the vast majority tend to leave the student phase. And so upon leaving the student phase, I have to almost adopt a new identity. And so when someone says, what do? You don't say I'm a student. you say, I work full time as, a banker. So all of a sudden my identity is kind of shifted and all my conversations shift towards that. And I might be socially kind of told I should be wearing a suit and a tie and a nice crisp shirt and some black shoes. I need to kind of be well groomed and I need to be highly professional. Call people by sir or ma'am, whatever it might be. I might buck the trend and say, no, I can wear some funky clothes and I can be the young new dude in the sector and have more of my flavor out there. But at the same time, that could be a dangerous maneuver if I want to stay in the tribe, or it could be an actual favorable maneuver where people might want more of that, more of me. So there's all these forces that are asking us to be a certain way, and this is why that real hard question, the philosophical question of identity, how much am I choosing? How much is the context, the world choosing? Even geographically where I live, the identity of rural Australians has to somewhat be different than urban Australians because of just where we live. And I would have to probably say that's the same for all countries. We're just contextually different or from country to country. That doesn't mean one's right, one's wrong, one's good, one's bad, but there's different flavors. There's a different taste to that soup that comes with these experiences. And maybe that's where, when we start looking at things like whether it be dissociative identity disorder or any of these other sort of categories, maybe that's where things like trauma, goes out and informs how someone might be experiencing the world and how they identify. And part of a psychologist's job is to question that identity and say, is that what it means? And it's quite funny because we get to question identity. We get to, in some sense, even potentially encourage a new formation of identity. It warms my heart when a client, comes back from a session and they say, I really kind of thought about what we discussed and I don't see myself as being weak or useless or pathetic or, to blame. I'm not sure what I see, but I'm not that. It's like, that's why I come to work. So in some sense, we're negotiating identity in our work all the time.
Mm. And you're touching on that last point. It's interesting how we spoke about how identity can kind of shift over the lifespan, but it can also shift it can go a certain way and then go back. And I say that particularly in people who are experiencing things like depression, anxiety, where they'll spend a few weeks really, really down and have this negative outlook and kind of see themselves as a depressed person and look at the world in a really gloomy way. And then kind of have maybe another few weeks where they're really optimistic and their kind of identity, the way they perceive their identity and the way others perceive them is quite different. And all of a sudden they're happy and they're positive and they're optimistic. So it can change so rapidly. And as you said, really dependent on the context that we're in as well. You touched on cultural differences and, the fact that where we're living might change our perception of identity. And what came to mind for me was the difference between individualistic and collectivist cultures. And often, here in Australia and other countries, when we hear the words, who are you? Tell us a bit about you. At least for me, I'll speak for myself, I'll jump straight into what I'm studying or my profession or my hobbies or my interests. Whereas in collectivist cultures, people might say something like, I am a daughter, I'm a sister, I'm a mother, I'm part of my community. So even just the pure chance of where we're born can have a drastic effect on the way that we see ourselves.
And another fascinating addition to that is I was speaking with Dr. Erica Penny not long ago for one of these episodes, and she was talking about narcissism or narcissistic personality and borderline personality, and talking about the prevalence of some type of trauma, which obviously, we all know about in that sort of space. But she was talking about that someone's, I suppose, upbringing and having ambivalent, for example, ambivalent attachment with parents, where there's kind of, warmth and also disregard or neglect or, punishment, and a child not knowing what they're going to get. Let's say, let me do something stereotypical, like, dad's a drunk, right? And, dad can sometimes say, come here and be very warm and cuddly and nurturing. And then another time, get out of the way, you're bloody always in the way, and be, obnoxious and difficult and abusive and, whatever that might be. That sort of space for a young person could develop into, an adaptive, mechanism as a young person of saying, how does dad want me to be? Who do I need to be to go out and make sure dad's on my side? And so I'm changing who I am to be accepted. And so Dr. Penny was arguing that in adulthood, someone might still go out and do the same, where they're highly fearful of rejection. They're looking for cues of rejection, but they're also looking for how they can go out and position themselves to be a certain way, to be liked, to be loved, to be accepted. And so there's this huge kind of conflict. And so when we look at particular types of presentations, there is great tension in that space of who do I need to be liked, but at the same time feeling high levels of upset, distress, or misreading positions, and then not knowing how to put in a boundary, or how to do it in a more diplomatic way. And so there's this kind of ongoing sort of tension in personality, in identity, where there's it's sometimes chronic emptiness, or that I won't be loved, or abandonment, and what that says about me, who I am, and that kind of can be a long lifetime sort of experience for from what's happened as someone being a child. And Dr. Penny talks about how we can go out and support these people in a beautiful way. Encourage anyone to look that one up. Really good conversation. But it's interesting that, what happens so early on in life can very much affect, how we see ourselves, and then not only that, reinforce itself, in through our actions and the way we are with others and ourselves.
Yeah, and I guess that also sort of alludes to the nature-nurture debate as well, in a way. And we know that identical twins tend to share a lot of the same personality traits. But if they've experienced different events, if one's experienced trauma and the other's experienced, really loving, caring relationship with their parents, their sense of identity and so many aspects of themselves are going to be vastly different. So the effect that our environment has, like you said, right from the time that we're born, throughout our entire lives is huge, is massive.
And one of the moderating effects, when I think about how, what can we do about identity, is in some sense we have choice. We have kind of choice about our actions, what we want to do, the sort of agency of our lives, and to a point we've got that. And I'm not suggesting that we've got full agency and that, we can achieve anything, and I'm going to place, point at people and blame them for whatever's going on. I'm not talking about that. I'm talking about trying to give active direction to our lives and to be actively, be a particular way, live in line with our values. So I think there's a lot that we can go out and do to inform who we are, and that's maybe kind of like one position. Another position is also to accept, to come to terms with, to embrace, in actual fact, those aspects of who we are, whether they're in conflict with something else or not, or just saying, hey, this is an attribute or a part of who I am, and I don't need to change that. I don't need to have agency over everything. And to have agency over something which I imagine you probably could, it's just going to be bloody hard, and it could be all consuming and mean that you have to neglect other areas of your life. So I think there is a balance, and I wouldn't even call it a delicate balance. I think it's just a balance of trying to carry both of those things as we go along and as we transition from one phase or one period in our life to the next. That is clearly around the corner for all of us, whether it's an age thing, whether it's a role thing, whether it's a relationship thing, whether it's a parental thing, or becoming an empty nester. There's all sorts of different roles and responsibilities, and how we go out and use agency, and how we accept those things that we are, and maybe be non-judgmental of others and the world too helps in doing that. I think all those things shape greater stability, at least, in our identity.
I think that's a really great take-home message. And I also think the point that you made earlier on about identity being fluid and us not necessarily having to categorize who we are into these little pigeonholes. I think that's really important for us to remember, and can really help when we are feeling quite anxious about our sense of self. If we are going through something like an identity crisis, for lack of a better term, to remember that we don't have to be one thing. We can be lots of different things, and those things can change over time, and they will change over time. When we get into different relationships, when we get a new job, when events happen to us, or things happen in our society, we will change. A lot of us will change, and maybe that's okay, and maybe that doesn't mean that we are a totally different person, but maybe it's just different aspects of ourselves, and maybe we don't have to define ourselves by any particular one.
Beautifully said. I think we could probably leave it there, and call it a day, and look forward to the next conversation. There's a few things I'd love to pick up on at a later stage, maybe some more controversial sort of areas, because I think they're complex, and I think philosophically they're hard to talk about, and often it causes angst in doing so. So, and I think identity is one of those, and certainly the gender conversation is a big one. Might have to spend some time, or I might have to get a particular speaker to come on and talk about it, because it's complex. And if we don't give voice to these things, then we, by virtue of going out and avoiding it, we make a statement about it, and we kind of say it's too hard, or it's too difficult, or I'm not allowed to say it in the wrong way. I think being somewhat clumsy and a bit vulnerable about it, and kind of recognizing we don't know all the answers, is really a big part of this podcast. So, I appreciate the opportunity to chat with you and talk about these sorts of things. And I think there's so much further to go, and hopefully some listeners can begin this conversation with others, and particularly the hard areas, whether it be multiple personalities, whether it be, variations in, gender identity, whether it be about life transitions, whether it be about our personality traits and how much they can move, so on and so forth. There's so many areas to continue this discussion on. This is kind of like almost like a catalyst, a taste test to get this conversation going. So I appreciate your time to explore this, and hopefully tip that first domino for further conversation. So thanks, Mary.
Yeah, it's been great chatting with you, Nesh. I really enjoyed this conversation, and I look forward to next time.
Sounds good. If you enjoyed this podcast, please support it by going to iTunes and putting a review. Subscribe, share it via social media, and tell others about it. Start a conversation. It's listeners like you that make this able and possible, and why we bring in these guests to go out and share their knowledge and resources. And just lastly, if you are a psychologist and you want to go out and be part of a bigger team, develop your experience and get into some exciting work, come to strategicpsychology.com.au/careers and reach out. I'd love to hear from you.